All right. We're live.
You're good to go, Borough President.
Thank you so much, and welcome everybody. Maybe I should say welcome back. Throughout the pandemic, during my time as chair of the City Council's Health Committee, we gathered on Zoom again and again with experts in medicine and public health and government to talk about the pandemic and what it meant for our city, what it meant for all of us personally and our families. I got so much out of those conversations and your questions. I learned so much. It was really a great source of support and strength for me during the past 2 years. We didn't think at that time that in 2022 we would need to continue to do those types of Q&As, but alas, this virus had different plans, and we decided that it was time to gather again, to bring in an expert to help us understand this moment and what it means for New York City and what it means for each of us and our families. And I'm really thrilled that we're going to be joined in a moment by Dr. Dara Kass, who I'll say more about in a moment, but she is currently serving as the Regional Director for the Federal Department of Health and Human Services for our region here in New York City and various other nearby states. But we have a treat that I guess we can say her boss, the National Director of Intergovernmental and External Affairs for the United States Department of Health and Human Services, has joined us, Mr. Marvin Figueroa, who, while he's visiting us from DC today, is a New York City kid from the Bronx, who has gone on to an amazing career in health policy. And so it's great that you're able to join us, Marvin, or Mr. Figueroa. I'll cue you to say a few words.
Thank you, Borough President Levine, and thank you for the opportunity to join you all today and for allowing a guy from across the river from the Bronx to join you. But on behalf of Secretary Becerra, Secretary of Health and Human Services, I want to thank you for all that you have done to ensure that your constituents have accurate information and all that you did before. Has really made a big difference. I'll be quick because the real star of the show is Dr. Kass. But I just want to also kind of thank the folks who have decided to tune in today. They have shown an interest in making sure that they have what they need to not only keep their families protected and safe, but also keep their neighbors and ensure that we're fighting back against some of the misinformation that we've seen. It's because of our community partners that we've seen an increase in testing so that we know where the virus is and we're able to work to mitigate its impact. It is because of the information that these folks have decided to really own and work with us to disseminate that we're seeing an increase in vaccination rates. And we are in the precipice of defeating this virus. Nonetheless, we still see that the virus is present. And so today's conversation, you'll get to hear more about where we are in a pandemic and what we can do together to continue the path that we're on. So before I turn it back to you, Borough President, I want to thank folks for all the work that they've done in the face of disbelief and despair. Because of the work that we've done together collectively, we believe, and the president believes, that we're going to be able to meet the moment. So I'm going to turn it over to you, Borough President, with my gratitude. There's no rivalry between the Bronx and Manhattan. We're one team and one family.
Amen. You're welcome in Manhattan anytime. No passport needed. And actually, Secretary Becerra, I think, is in Manhattan now, or has been today, which is great. So he was speaking at the annual convention of the National Action Network, where I had a chance to be yesterday. So, boy, we got a great representation of our federal health partners in Manhattan today. We're grateful for that. And great to see you, Marvin. You're welcome back anytime.
Thanks,
so while Dr. Kass makes her way back to the computer screen, I want to welcome all of you again. I see that some of you are already posting questions, which is great. We want to make this as interactive as possible. And some of you who have been on these before know that I get to as many of your questions as we can. And so you can post your questions. We'll try to get to as many as we can. We're both going to focus on what this new wave means for our city, but also the personal perspective of what it means for us as people and individuals. And I can't think of anyone better to have joining us than Dr. Darrah Cass, who is a veteran emergency room physician who served in the ER here in Manhattan throughout most of this COVID crisis. So she has frontline medical experience during this difficult time. She also rose to be one of the more prominent medical voices in the media throughout the pandemic that you might have seen on national cable news and other outlets explaining COVID in very compelling and understandable terms. And she could have walked away from all that and said, I need a break. But no, that would not be Dr. Dara Kass. She has gotten into the arena again, a different arena. She is now a member of the Biden administration as our New York and New Jersey and other area regional director of the Department of Health and Human Services, based here in Lower Manhattan. So she's continuing to serve. And I'm really thrilled that you have joined us today, Dr. Kass. Welcome.
Thank you for having me, Borough President Levine. I will default into calling you Mark regularly during this call.
Please do.
I know. Look, I was honored again to be asked to do this with you. We've done this. We did this over the course of, the past couple of years. And, I am frustrated, I think, like many of you, that we do still need to do this, that there are still questions that we had. There are still policies that don't feel even across the board, or people want to know, why is this affecting me, or what do I need to do now? I've done so much already. I think I just want to kind of acknowledge before we even start the level of frustration that many New Yorkers have. I mean, I was an emergency medicine doctor in the ER at the very beginning of this pandemic. And, we all played our part, right? We hear so much about what New York did in March of 2020. We pulled together, we put on our masks, we looked out for each other, we treated each other with respect. We stayed home if we could, we went to work if we had to. And, over 2 years later, we're still being asked to do more. And that's really hard. It's hard as we look to our kids that are under 5 that aren't vaccinated. It's really hard for our teenagers that are trying to have a normal high school experience. How many years of school do we say, oh, we'll catch up at one point? It's hard for our parents. I unfortunately just lost my father, and the last 2 years of his life were abrupted by this chaos of should he go outside and not go outside. And he didn't pass from COVID, but it certainly affected his golden years. And I kind of want to acknowledge that as a foundation level set of even having this conversation, because so much of the frustration we feel like informs our approach to the policies that we're dealing with right now. And I kind of try to let go of that if I can, and I don't know if anyone else can, but this is how I try to approach it for my life.
It is hard, and that was beautifully stated. Of course, we're deeply sorry for the loss of your father. This has been one more challenge for you and your family in this difficult 2 years. For folks who are posting your questions, I want you to know that we're seeing all of them. And I'm not sure, I think the chat might not be visible to the public, but we're seeing all of your questions. They're excellent. Some are comments. We're going to get to as many and hopefully all of them. So keep them coming, please. But Dr. Kass, could you start out by telling us, what is BA2 and how is it different from every other version of this virus that we've had to deal with over the past 2 years?
So this variant dance we do, right? So what's the current variant? What does it mean for us? How quickly can we learn how contagious something is? Will our vaccines work? Which medications work? I think the other issue around these new variants, and this is coming up over and over again in the most recent few months, is which of our monoclonal antibodies will work. And we'll talk about that. I think later on we talk about some therapeutics. So BA2 is a similar version to BA1, which we called Omicron. There was a period of time we talked about the city that it was identified in, and then we talked about it as a numbers or letters or Greek letters. And I think eventually we'll get to some clean system that is consistent. BA2 is a highly transmissible version of COVID that seems to be responsive to the vaccine. So the vaccines do work in protection. Unfortunately, the protection is really about hospitalizations and deaths, meaning that the severe outcomes that we have been looking to protect our communities from, keep our hospitals open, are still working with the BA2 variant. But we have seen continued transmission amongst people that are vaccinated and even people that are boosted. And that level of, I think, frustration around people that have done their part, that have gotten vaccinated, that have gotten boosted and still getting COVID, I think we need to understand and explain what that means. And so what we really see is that people who get BA2 after being vaccinated and boosted generally have a relatively short course of illness. They find themselves positive on a rapid test. They have a sore throat, a stuffy nose, some fatigue. They take over-the-counter medications, and many of them do very well from there. Some of them will need to get those therapeutics we can talk about. And then there are a few people, unfortunately, who are still vulnerable to this virus. Some who are vaccinated and boosted, and some people who are not vaccinated at all, that will find themselves in the hospital and unfortunately pass away.
So a question I'm often asked is, if I got Omicron, and that might describe half New York City.
It is. No. The estimate on Omicron originally before like March was 45% of New York City.
Well, there you go. So the question I'm often asked is, if I got Omicron, as I did and you did.
So 100% of this call.
Right. Can I get BA2?
I have been asking that question literally myself. Okay. I have gone to people in the CDC and asked this. Right now, the problem with this pandemic has been that the questions we ask are too new for the science. So we have been asking these questions and having to wait for answers, which is so frustrating. It does not seem that people are regularly getting BA1 and BA2 with frequency. Many people who've had infections from December and January still seem to be protected. There's a question of people who got Delta in December or January, when it was still hanging out in certain communities. Now they're getting infected again 90 days later. So what I would say is that the CDC recommends that within 90 days, you don't need to worry really about getting reinfected. After 90 days, it level sets again. And the reason I bring that up is because when we think about quarantine possibilities, so if like my daughter got COVID 2 weeks ago, and it was 91 days after my previous Omicron infection.
And as it so happens on the calendar, most of us who got Omicron at this point are either already 90 days or going to be there pretty soon, right?
Right. And so that bridge of 91 days was a trip that I was supposed to take within my job to Puerto Rico. And, the CDC says that if you are exposed, even if you're vaccinated and boosted, you should not do voluntary travel. So I stayed home and I tested myself as I would from an exposure, and I didn't contract it. So hopefully the protection was there, but I did act as if, because it was over 90 days, I reverted to the CDC guidance of what it means.
And I just want to acknowledge we're getting so many great comments in the chat. And a lot of them are on both sides of the mask mandate issue. I promise you we're going to address that. I don't want anyone to think they're being ignored. We're going to get into all that. But you did mention, Dr. Kass, another area where I get so many questions. What is the current guidance on isolating / quarantining? If I test positive, if I have a family member who tests positive, if I have symptoms but test negative, what is the guidance currently on
so that? Let's go with people that are vaccinated and boosted, or certainly up to date on their vaccinations. And the reason I say that is because that's the majority of people that that are probably on this call. If you're not vaccinated, the recommendations haven't changed, which would be to isolate for 10 days and test yourself, if you can over the course of that 10 days, but really to isolate for 10 days. And that is not a great way. It's inconvenient for work. It's hard for your family. It's disruptive. And so that's one of the reasons that we recommend primary series vaccination for everybody. Okay. So got to get that off. If you are fully vaccinated and boosted and you're exposed, like I was, when my daughter had COVID, she was in my house. We had a close exposure. If you are fully vaccinated and boosted, you want to mask up around other people and you want to test yourself at 3 to 5 days. You don't have to quarantine yourself. If you can go to work, but you should wear a mask. And that mask is really in case you start to develop symptoms or you test positive, you will have decreased the risk of transmission to anybody else. A lot of the reasons we quarantine is not because it's going to affect whether or not we get COVID. It's when we get COVID, will we pass it on to somebody else? And if you think about it like that, it really informs how do you interact. If you're working remotely from home still, then you can just go about your business and, test yourself at 3 to 5 days. If you need to go to the grocery store, you put on a mask. If you start to develop symptoms, test yourself. And this is actually really important because there will be a question, I think, in the chat eventually about the efficacy of rapid tests, especially around Omicron. So everybody should have rapid tests in their house. Mark, would you like to tell people where they can get rapid tests in New York City?
Wow, there are so many places. The good news is that we have more rapid tests available in New York City now than at any time in the pandemic. The city actually just secured a supply of millions, I'm not exaggerating, millions of rapid tests. And you can get them for free at any public library branch in the 5 boroughs and at a huge number of cultural institutions as well. There's an increasing number of elected officials who have a supply and are giving them out. We did a huge giveaway this morning in Uptown Manhattan. So it is easier to get rapid tests than ever. One more place you can get rapid tests are the brick and mortar city run test sites. This is great if you like get there and it's a line and you don't want to deal with it. They can just hand you a rapid test and you can go home. But the truth is that when I had COVID in December, and think you as well, we each had symptoms for a couple of days that we were pretty sure we had it, but we were getting negative tests on the rapids, and then boom, on whatever day 3 or whatever, it was positive. So is that actually a thing now that antigens tell us? Yeah.
Yeah. And I want to be clear, I think to just bring us whole kind of into the family about the community that we live with in New York and how we really are interwoven. You literally had your infection. We walked through the fact that you were testing negative, but we were both convinced you had it. You tested positive, and literally, I think it was within the week, I started having symptoms. I was testing negative. I told you that reinforced our process about what happened to you. And then I tested positive. And the reason actually is pretty amazing. The prevailing reason people think that people have symptoms before they have positive tests, and this is for vaccinated people, is that's your immune system at work. That's your immune system really fighting off that virus before you have enough measurable virus in your system to have that positive test turn positive. Fortunately, when that rapid test is still negative, even if you're symptomatic, it is unlikely that you're contagious. And we've seen this a lot in communities where people have been rapid test negative, turned positive, but they've decreased their interactions with other people. And then nobody in their life gets COVID from them. Once that test turns positive, they were able to isolate pretty effectively. And that's actually the great warning sign of this version of COVID, which is that because we're all vaccinated and because we're all boosted, we're getting a warning sign from our body. And sometimes it's seasonal allergies, and sometimes it's just another cold. It's not always going to be COVID. But if you are taking a COVID test and it's negative, and you're having a severe sore throat, or you know somebody that has COVID, or the numbers are going up in our communities, kind of like they are now, make sure to take another test the next day or 2 days later. It's that second test, if your symptoms persist, that's often positive. And that really is that window where you've turned probably infectious that really gives you a chance to remove yourself from anybody in your family who might be vulnerable. The example I give always is I have a 9-year-old son who is 7 years post liver transplant. And when my daughter turned positive, it was really important in our family that we remove her from his risk, because even though he's vaccinated with 3 doses, because he's a transplant patient, that he not get exposed unnecessarily from her.
Exactly. What about PCRs? Are they more likely to show you a positive result at that early stage, or that similarly it might take a while?
So PCRs are more sensitive, meaning if a PCR is negative, you definitely don't have COVID. Okay. PCRs show virus that exists in your body, but it doesn't show the reactivity of that virus. And so it's often too sensitive for what it means to live our lives now, which is if you're not in the hospital, so you're not in a high risk setting, you're not in a nursing home, you're not in a hospital, you generally don't need to know if there's virus living in you, if you're asymptomatic or not transmitting any, you're not infectious. And so the reason we've pivoted away from PCRs to rapid tests is more about what the test tells you about how you need to live your life. So if your rapid test is positive, you are likely infectious and you want to remove yourself from interacting with other people. If your PCR is positive, you need to do that too. The question is, are we chasing PCRs for people that are not symptomatic or infectious? And that's why we've really kind of stopped doing PCRs on asymptomatic people that are fully vaccinated and boosted, because we're trying to make sure that we're finding information that matters to the spread of this virus, to preventing other people from getting it.
Okay. I do want to also offer one important update on the testing landscape now, which has been disrupted by Congress's failure to extend COVID response funding. And this was really critical in New York for our testing infrastructure, specifically those private test sites like the vans you see on the street or the tent you see on the street or CityMD. CityMD, despite that it has the word city in its name, is actually a private company. They were all getting reimbursed if the patient did not have health insurance. So you could go in there, you didn't pay, insured, uninsured, it didn't matter. That ended about a week and a half ago, almost 2 weeks ago. And so some of those locations have closed. If you have noticed fewer of those pop-up type tents and vans in your neighborhood, that is why. Most of the rest, I think I can say even all of the rest or almost all of the rest, are now charging if you don't have insurance. And I'm talking fees, $50, $100. If you go to a private site, ask before the test if there's going to be any charge for you. Establish that up front because you might get hit with that cost. If you don't have health insurance, you can always go to a city-run site. They are offering it for free, regardless of your insurance status, your immigration status. So you have that as a backstop. And of course, I talked about the distribution of rapid tests that we're doing now. So you do have other options. I don't want to minimize what a problem it is that we've lost this federal funding, and it will also ultimately impact treatments and vaccination long-term. So it's got to be fixed.
Remember also, wait, I'm interrupting you because remember you can also go to covid.gov and the federal government will provide 4 at a time, but you can go in twice if you haven't done it already and get rapid tests delivered to your house. And so I want to remind people
that website again.
It is covid.gov because it's an easy website to remember and it is available for people to just go on. There's links to treatments and all kinds of other resources, but the most important thing you can do is you click on order my COVID test now. It is cost of $0. The USPS, will deliver it to your house. In the very beginning of the program, there were, I think it was 50 million tests were ordered, and then another 50 million after that. And there was a rush for the tests. So there was sometimes people waited 3 or 4 weeks to get their tests because they were delivered to the highest need communities. I reordered mine last week when my daughter got COVID, and it took 2 days.
Excellent. We're getting a number of questions about vaccines, particularly the boosters and even potentially 4 shots. One question is about, should you mix and match for your booster or boosters? Another one, we've had another couple questions about sort of how long after your first shot should you get your booster? And maybe we'll leave the 4 shot as a separate question, but if you could just talk about the question of mixing and matching on boosters and how long you should wait.
So I would say that you want to make sure you get an mRNA vaccine at some point in the course of your vaccination. So if you started with the Johnson & Johnson vaccine, you want to boost with an mRNA vaccine. Which one it is doesn't actually matter. There are lots of people, including me, who, when they got their booster, decided to get a Moderna if they started Pfizer, or depending on what their options were. Obviously, if you're under the age of 16, you don't have that option. So my daughter, who's boosted and 14 years old, she got 3 doses of Pfizer. The truth is there's not really, compelling data on either side, although most of us, I think, have tried to mix and match. It doesn't seem to be detrimental. And you just hope that maybe there's an advantage. But what I would say is the most important thing is to get the booster. So if you go to the vaccination site and they have the same vaccine you've been previously vaccinated with, don't leave. Get that vaccine because that's the most important thing.
Okay. So you can now get a 4th shot in anywhere in the country if you're 50 years older or 50 years or older. In New York City, this hasn't really gotten, I think, reported on, but there's been some technical challenges in the rollout, and you haven't been able to sign up for an appointment at the city-run sites for a short 4th shot. You can actually still walk in, and they'll just set you up on the spot. I'm hoping that's going to be fixed very, very, very soon. I'll update you on that. But many people are asking, Do I need a 4th shot? Does it depend on my age or my medical condition? When should I get it? Some people are saying, maybe I want to wait a little bit longer until maybe there's a new flavor or variant on the scene and I can get an adjusted formulation. Talk to us about 4th shots.
Okay, so let's leave the adjusted formulation conversation separate, since there's no evidence that they're getting adjusted formulations to address new variants, that the variants we have circulating right now are responsive to the vaccines we have, and there's no reason to wait for a new variant-specific formulation for the information we're dealing with right now, okay? Everybody over the age of 12 is eligible for a booster 5 months after their mRNA vaccine and 2 months after their J&J. I'm going to sneeze. Allergies. So trying to wait for that sneeze to come. So that's first of all. So that's a regular booster. My daughter who's 14 is vaccinated. My husband who's 49 is boosted and vaccinated. I am 40, almost 45. I am boosted and vaccinated. However, my mother, who is over the age of 70, but if I tell her on this live stream how old she is, she's going to kill me. She is eligible because she's over 50, because it's hard if I'm 45 almost for her to be not over 50. My mother is eligible for that 4th shot. And more importantly, it's really important that my mom gets that 4th shot. If you're really over the age of 65, and that's where the data came from, you want to get that 4th shot as soon as possible. That 4th shot is about your protection against hospitalization and death and preparation for your body to expect to see that virus again. You know, we are seeing higher numbers of circulating virus in our communities. And as other considerations change, as people change their behaviors, as people venture out, right? And as there is varying levels of people wearing masks or other testing before events, you're going to want to have as much protection as possible, especially if you're over 65. If you're in the 50 to 65 age range and you don't have an immune compromised condition and you don't worry about your own, kind of need for hospitalization, and especially if you're a little hesitant because you've had a COVID infection, maybe like you've had, kind of have post-infectious immunity as well. The recommendation is talk to your doctor, see what they say. They'll give you advice that's appropriate for you, and then you can act accordingly. This is now turning into a moment where we're evaluating our own risks. We know ourselves, we know our families, we know our own personal, risk aversion. I have plenty of friends who are under 50 who are asking me when can they get their 4th shot, because they'll take 92 shots if it's given to them to keep as much protection as possible from this virus. There's a whole spectrum of people willing to be vaccinated. And so we need to meet people where they are and give them the information to act accordingly.
Yeah, so that is extremely helpful. We're getting lots of questions about the new treatments that are now available. I also got COVID in March of 2020.
So did I.
I just can't be left out of any wave. And I remember at the time I spoke to someone at the health department, and I couldn't even get a test because, it's hard to remember, but testing was in really, really, really short supply in those early days. And the doctor said, there's no point in getting a test because if you're positive, there's nothing we can do for you. If you have respiratory failure, get yourself to an ER. Otherwise, just rest, take, whatever painkiller or hydrate, et cetera. The truth is, just in those early days, there wasn't much we could do for someone unless they were really in a life-threatening situation. Today, thank God, we have much more we can do to treat people. And it's one of the reasons why I tell people to get a test, because now you really can do something if you know you have COVID. So if you have symptoms, don't be a New Yorker and tough it out and say, I'm just going to, pound through this. No, you want to know if you have COVID, because if you're high risk, especially, there are things we can do. And it seems like, Dr. Kass, it's the monoclonal antibodies. And a lot of people in the chat are asking whether those work against BA2. Mm-hmm. And then I think what is extremely exciting is this new antiviral pill or pills that you can take. Paxlovid is the most famous one. Tell us about the treatments people can access, who should get them, and your guidance on that.
Okay. So a couple of things. So yes, it's very exciting. There are therapeutics, and the therapeutics is a fancy word for medication. And it's really important that you're vaccinated and boosted before you get infected. But once you're infected, it's not just Tylenol, Motrin, rest, and let's hope everything is okay. You're absolutely right, especially for outpatient treatment. I spent the beginning of this pandemic doing a lot of telemedicine, and it was very frustrating to listen to people's concerns and give them no options. And that's not what's happening now. So there are basically two buckets of options for treatments as an outpatient. One are monoclonal antibodies, and the other are these oral antiviral pill packs. Okay. So I'm going to talk about the pill packs for a second, because they're not evolving the same way. So those are courses of medication. They're kind of like, if anyone's ever taken a Z-Pack, it's similar. It's 5 days of pills, and they come in a package that allows you to take, 2 at a time over the course of, multiple times a day. And they're a course of treatment, and they affect the viral replication in your body. And they really decrease the risk of hospitalization and death. I mean, Paxlovid in its studies decreased the risk of hospitalization by 80%. It's pretty remarkable what they can do if taken within 5 days of symptom onset. So it's really important that you get that test as soon as possible. It's also important to realize that if you're over 50 and you are infected, it's really important to talk to your doctor as soon as possible to get on those medications. They are best used early in the course, not when you feel terrible, but before you feel terrible. So my mom was at my house, and one of her friends called, and he's an 80-something-year-old guy, and he felt great. And he took a rapid test because he was exposed and it was positive. And I had to convince him to call his doctor and get those pills, because that's when it works the best. So in conjunction with your doctor, do that. Monoclonal antibodies are something different. They basically mask like another vaccine surge of antibodies, right? They are synthetic antibodies that are created in a lab that really have to mirror the virus that's circulating in your body. And the reason why that's important, it's kind of like this lock and key model. If the lock changes, the key sometimes won't work. And so as we see new variants and they shift how they're exposing the outside of their virus, the shell of the virus, it does change how these monoclonals can be effective. And so that's where the federal government comes in, and how important it is to have an FDA and a CDC that are plugged into what's happening on the ground in communities. So for example, when the BA2 surge started in New York, the CDC communicated with New York and New Jersey and the entire Northeast that they were going to stop the release and the approval of one of the monoclonals that was no longer effective, and make sure that patients were not getting medication that was not effective. So it's really important for people to understand that if they go to their doctor and they get a monoclonal antibody, that is the one that works, because the job of the federal government is to make sure that with the state governments, we are only giving you medications that are effective for the version of the virus that is circulating in your community. And, that's where we are now. So if you go to the hospital and they offer you monoclonals, or you call a telemedicine visit, you can feel confident that monoclonal should work for you.
Okay, that is excellent. Adina Garver makes a point here. It's so good. I'm just going to read it. She says, needing to get Paxlovid within 5 days of symptom onset is another reason to get a PCR test to catch COVID-19 as early as possible. I really hope the PCR tests remain available to all, regardless of insurance status in New York City, until the pandemic is really and truly over. Again, it's just so important now. Get your test. Know whether you have COVID. And if you do, contact your medical provider. There were some questions about, what happens if I don't have a doctor? And there are many people in the city who don't have a doctor on speed dial. And so the city has a COVID hotline. It's 212-COVID-19, and they will connect you to a provider. You can actually get through to a doctor on the spot or get a call back, and they can talk you through your risk profile and determine whether you are eligible. We have a great system here where Paxlovid is not, you don't get Paxlovid out of your local Duane Reade. There's one central pharmacy that will dispense it in a matter of hours, usually, to your home for free. So if you test positive, you contact your doctor, they determine you're high risk, you likely, virtually certainly will have it same day. And it's free no matter what. There's no insurance issue there on the Paxlovid. This is great.
Wait, Mark, I want to just put a pin in that for one sec, because you're totally right. First of all, New York City's program on home delivery of Paxlovid is a leader in the country. And I think everyone who lives here should really acknowledge that the health leaders of our city have done an incredible job. There is also the federal test to treat program, which means that you can go to a pharmacy and get tested right there and then get your prescription right there as well. However, and those are in conjunction with the city. Now it's a different portal of pill availability. So we're seeing some patients in New York City get through the CVS pharmacies if they go in and they're positive. But the amount of patients in New York City that are getting through the COVID-19 hotline and direct delivery is still the majority of how we're seeing patients get their medications, and both are incredible ways to get medication.
Okay, great. So we do have a couple questions on long COVID. One for someone, I'm not going to say their name for privacy reasons, but I think it's an individual who believes that they are at risk for long COVID due to medical condition. And the question is whether that should be should that give them access to Paxlovid? Is Paxlovid likely to reduce your risk of long COVID, or do we know?
So Paxlovid is not approved as a preparation, right? As like a pre-exposure prophylaxis is what we call it in all kinds of medications. We know we do that for, exposures for other viruses. There is a different medication that is available for pre-exposure prophylaxis in high-risk patients called Evusheld, which is separate. And that would be for patients that have high risk of COVID outcomes, not long COVID. Patients who have
Evusheld.
Yes. And that is...
That's prescribed as essentially a daily pill that you take if you're very high risk.
It's a pre-exposure prophylaxis. I'm just going to leave that there because it's for a very specialized group of patients, and it has to do with supplementing your antibody risk, like it's like free monoclonals. The reason why I'm bringing that up is because we do not prophylactically treat against the idea of long COVID because it's incredibly difficult to predict who would get long COVID. But we do know that vaccination and boosting is absolutely the most robust protection you can get for developing any symptoms of long COVID. So if you are worried about having long COVID, getting vaccinated and boosted, and if you have symptoms of long COVID, vaccinations in some people has been shown to improve those symptoms as well.
Yes, that's been almost miraculous. No one expected that. Excellent. Okay. So we have a number of questions kind of related to older individuals and to the extent that they should be altering their lifestyle choices now. Should they be avoiding large gatherings? We had a very good question about someone's mother who I guess gets a home care aide and whether they should be demanding that the home care aide test regularly. What is your guidance on how someone, say 75 plus, should be navigating life at this stage of the pandemic?
My mom's. Oh, no, I just really did give her age. Okay, so let's go back to this. So first of all, it's everyone's risk profile. So my mom and I had this conversation a lot where she's like, I'm not dead yet. I need to live my life. And she wants to engage. She wants to play mahjong. She wants to hang out with her friends. She's willing to test regularly, and she's willing to ask her friends to test as well during gatherings. She's fully vaccinated and boosted, and she knows where to get medications if she turns positive from COVID. In many ways, that's about as good as we can do. If there's somebody coming into your house regularly, maybe they're coming to serve as a home health aide, maybe they're coming to help you with cleaning, maybe they're bringing you groceries, or and they're in and out, and you're worried they're bringing that virus in or they're putting you at risk, you can absolutely ask them to wear a mask, right? You can wear a mask yourself when they're around. That layered protection, it doesn't go away. Every time you do it, it matters. So if you're worried about some interaction and you are worried about your risk profile, you can mask up when somebody comes transiently into your house and wear a mask at the grocery store. But otherwise, go about your business, test before dinners. I mean, that's what all these resources will help us do.
Right. So we're getting questions from people who are, we're giving so much information. I think some of it is hard to catch. We're going to post this video on all our platforms as soon as we finish, so that if you missed it, you can watch it. But I am going to repeat one thing that there were some questions on, which is just really important about how do you access Paxlovid if you're in New York City? Again, this is not like a normal medication. It's not picked up at your neighborhood pharmacy. The only way to access it is that your medical provider, your prescriber, has to call in a prescription to this one official New York City Health Department approved pharmacy. And providers have all gotten a letter from the New York City Health Department on the number and how to access the pharmacy. It's called Alto. You don't need to know that. So really, you need to go through your medical provider, and they will call in the prescription for you, and it will be delivered to your home same day, and usually in a matter of hours. And while you might have heard a lot of reports in the Omicron wave about Paxlovid being an exceedingly short supply, as of today in New York City, we have enough supply to meet the demand. So as my understanding, correct me if I'm wrong, Dr. Cass, no one is getting turned down for Paxlovid because of a supply shortage. There are criteria that you must be deemed high risk, and et cetera. But people aren't being turned down who otherwise qualify because of the shortage. We got a question about pulse oximeters, which have been useful throughout this pandemic. And someone heard that for people who have dark skin pigmentation, that they don't work as well. And I wonder if you could comment on the accuracy of that.
So that's actually true. So pulse oximeters, they work by transmitting light waves through your skin, and there actually is evidence, there's good data, it is true that that based on your skin tone, there can be differences in the efficacy of many different pulse oximeters. There was also a paper that just came out today, and it's very new information about whether or not home pulse oximetry changed outcomes during this most recent wave, and whether or not, the feel that finger pulse ox versus the feeling of being short of breath, which one of them was more effective in really identifying people that were going to have, need to see the doctor. And the way I would say it right now is this: if you are concerned about your ability to breathe and you have COVID, go to your doctor. And if you can't get in touch with your doctor and you need to be seen in a hospital, you should go. Okay. We are not in the position right now where we need to tell people to avoid hospitals or avoid ERs because of the volume of patients coming in. So pulse oximeters have been shown to have different effectiveness based on your skin tone. That is true. And so that is important to take into consideration. But if you have any questions or concerns about your safety at home or whether or not you need to be seen in a hospital, it is not the time to take that into your hands. You should go.
Yes. And tell me if this is accurate, but your body knows when you're not getting enough oxygen, and you can sense that you're having trouble breathing. You can sense that you're having trouble getting a whole sentence out without pausing for breath. So it's is it accurate to say it's unlikely that you are at a low oxygenation level and wouldn't otherwise know it without getting or is that not accurate? Please.
I would say that COVID has humbled all of us as far as what we're used to seeing and not used to seeing. I will say that if you feel short of breath in the face of COVID, or honestly not at all, look, there are lots of manifestations of anxiety that can make you feel short of breath as well. And so knowing you have COVID and worrying about that, it may make you feel that, that you need to be seen. But this is not the time to worry about getting seen to the doctor. We can see you quickly. We can check your numbers. We can listen to your lungs and make sure you're okay. Make sure you have the resources you need and send you home very quickly. We are able to take care of every patient that needs our care.
Okay, so we have a very specific question on this that just came in. Could a pulse oximeter give early warning of low oxygenation before you have symptoms?
So that was actually the study that was done. It was patients who had COVID who went home with a pulse oximeter to check to see if their pulse ox dropped before they felt short of breath. And what the study showed was that it didn't make a difference. So what I would say is having a pulse oximeter that works accurately. So you take it when you're not sick, it says 99, and you can rely on it is not necessarily a bad thing. But if you feel short of breath, despite what it says, you may want to go in. And one of the other things I say to people a lot is you should walk with it. So one of the things we track a lot is the change in the number, not only the single number. So if you're walking and your number falls, that would be another reason to maybe consider being seen.
Got it. We're getting so many questions on Paxlovid. This has been a hot topic. I just want to clarify again. People are asking the definition of high risk, which is age 65 plus, I believe.
That's elderly, I think, like not to get my mom mad at me again. So what I would say is this: anyone over the age of 65 who has a comorbid condition, this is what we call it in medicine, right? Hypertension, diabetes, heart disease, unfortunately for COVID, obesity is included in those. You would want to speak to your doctor, but I tell everybody over the age of 50 that they should call their doctor or 212 COVID-19 to ask if you're a candidate for Paxlovid or monoclonal antibodies. And I want to be clear about this. So there are patients who need quicker and more robust protection than Paxlovid may provide. And one of those groups of patients is, let's say, transplant patients. So if you are an adult transplant patient and you are fully vaccinated and boosted and you find out that you have COVID, your doctor may choose to send you for monoclonal antibodies, or if you're later in the course of illness, they may be more effective in making you feel better and also resolving your symptomatic disease faster. So that's another reason to call a doctor, is so they can decide which of these two paths is best for you.
We've gotten so many comments and questions, mostly comments on COVID and children. Can you talk to us about the risks that kids face? And the answer might be different for teenagers versus little kids as well.
Yeah, so it is. And I think that, we need to think about this right now as the above fives and under fives, right? So above fives are eligible for vaccination, and they should all be vaccinated, in my opinion, and really based on the science. I have 3 children over the age of 5. They are all vaccinated and boosted where eligible. That is the best protection to them to, if and when they get exposed to this virus, especially as we see more transmission in our schools without masks, which we're seeing, and that's to be expected. It was a decision. We know that these children are eligible for vaccination, so they're protected. There are some schools with 100% vaccination rate in children 5 to 11. There are some schools with 30% vaccination rate in children 5 to 11. So we need to get those 5 to 11-year-olds vaccinated, and we will continue to provide information on how safe and effective it is. Under 5 years old are not eligible for vaccination yet. And so they need to be protected by A, being around family members who are vaccinated and boosted, B, having frequent testing in their community, which means after school if they are exposed, if somebody in their family has COVID, and masking up where necessary. I mean, again, younger children don't have, there is a proportionality in age increase for the likelihood of having, bad outcomes and hospitalization and death from COVID. But there is not a lot of understanding about what it means to survive a COVID infection, on brain development, on long-term immune response, on other things that we don't have answers to. What we do know is not getting infected is the best option. And so doing the best you can to avoid it is a good idea. We're not going to be able to prevent infection in all children, certainly not in all children under 5, but we're going to do the best we can. Oh, and the other thing I will say is pregnancy. The best way you can protect your newborn baby from COVID is to get vaccinated in pregnancy. There was really good data showing that pregnancy vaccination or pregnancy boosting lets those babies get born with protection, which when there's no vaccine for them is the best way to get them protected. So
what do we know about the vaccination's benefit or risk for the mother or the
So the overwhelming data, and we don't have a lot of data that's this good, right? COVID, like this profound. Pregnant women should be vaccinated and boosted for their own safety and for their baby safety. There is enormous data on the amount of patients who are unvaccinated and pregnant who have, outcomes like, unfortunately, stillbirth or hospitalizations, premature delivery. Vaccinated pregnant people and boosted pregnant people do not have the same level of complications. And again, it's healthier for your baby. You are doing your baby a service by getting vaccinated yourself, and you are helping to protect yourself. Pregnancy is an immune compromising condition. It does affect your ability to fight viruses. We've seen this over and over again. Every pregnant person should be vaccinated.
So we're getting so many questions and comments about long COVID. And I think long COVID became a term being used publicly pretty early on in the pandemic. Definitely, I would say by May of 2020. But I'm hopeful that we've learned a lot more about it in the last almost 2 years. What do we know at this point about who's likely to get long COVID, what the symptoms are, and what treatments there are, among other questions? Do we know more today than we did 2 years ago?
We do. We know more today than we did 2 years ago. I think that long COVID is one of those diseases we're going to have to understand more and more over the next. It's going to be a new illness that we're going to have to understand more and more through research and collaboration. It is unfortunately a real. It is something that has manifested as a large number of people that are newly disabled or have a new chronic condition that they were not expecting from this. And so it's really, really important that we acknowledge the experience of people that are having prolonged symptoms from COVID, that we acknowledge the need for research and collaboration. The federal government is committed to dedicating resources to this and to really bringing out that level of collaboration, because there's no other way to solve this. It's going to take time, which is very frustrating. This is a life-altering experience for many people that have had long COVID. And it is unexpected. We, again, know that getting vaccinated and boosted before you get COVID is the best protection against long COVID. And even getting vaccinated after you develop symptoms of long COVID seems to help.
Do we know if the fourth shot potentially also offers benefits? We don't know yet.
It has been a week since they've approved the fourth shot.
Good point.
Borough President Levine, can you please ask me questions I can answer?
I'll get back to you on that one. So I want to focus on the future and what's next for New York City and all of us in this difficult pandemic. We are in the midst of what so far has been a fairly mild wave, but cases in New York City have, depending on how you count it, tripled from a relatively low level, but that's a real increase. Positivity has gone up as well. And we're just starting to see a little bit of an uptick in hospitalizations. Thankfully, not so much, in part because of some of what we've been talking about today. Treatments that are available that weren't, how many people have already had the virus, how many people are already vaxxed and boosted. So we have more going for us than we have in previous waves. But people are getting sick. I imagine every single person on the Zoom knows someone who's gotten COVID in the past month. And so you do the math, it's out there. And it's real. We look at the UK, that has been our pandemic bellwether, and pretty much every wave that hit the UK and London has hit us in a few weeks. And lo and behold, they had a bad wave a month or so ago, and now we're getting one now. Their wave did ultimately, while being nowhere near as bad as Omicron, did lead to a significant rise in hospitalizations and even deaths. We don't know if that will happen here. We hope it will not, but we need to be ready for it. Can you say anything about first, how do you think this wave will be for New York City, for America? How worried are you about it?
So I would say that I'm really proud of New Yorkers. I'm proud of really everybody that's gotten vaccinated and boosted. And I think that always is the foundation that we evaluate our situation from. I will say that also robust testing, city infrastructure really has delivered in preparation for this moment. And I really want to acknowledge that because it informs my perspective on what this means. For many, many people who developed COVID after vaccination and boosted, testing at home for rapid testing, who have the ability to stay home to prevent the spread of this virus, this will be just inconvenient. And I use that with the privilege to know that that's not.
Oh, we lost Dana. Darrah, sorry, we lost Dr. Kass. Dr. Kass, we lost you. She's going to make it back. Don't go away, everybody. Come on in. Here she's coming into the magic. We were across the hall from each other. Welcome. You can have a seat. Continue.
So I acknowledge the privilege of knowing that that's not true for everybody. But the bottom line is that for those that need the resources, we have them. And that's what I want people to understand is if you are concerned about the outcome, if you're worried about your hospitalization, in spite of being vaccinated and boosted, you have the chance to get those resources in New York City. And so I'm not as concerned as I was before when those resources were not available.
That is good news. Apparently your computer is back on. I know this was a little bit of a live TV snafu, but fortunately Dr. Kass was only down the hall. So we were waiting to surprise everybody. Dr. Kass, will this be our last COVID wave?
No.
Tell us what the longer term outlook
So I would
look,
think
it'll
that
be
as
like-
long as we're seeing new variants pop up around the world and the risk of people getting infected and transmitting new variants, we will continue to see these waves come into our communities. But we will be less and less vulnerable to that. We will see our protection layered. So every time we are infected and develop post-infectious immunity, every time we get a vaccine, we increase our protection. And that's really important for our community to move forward. I'm not going to be able to say that we're all, not going to see a wave again. I don't know how excited we are, but I think that that's.
We're going to model good behavior here, Dr. Kass.
We definitely can. I'm sorry, this is a abrupt last minute
And
decision.
unplanned.
Unplanned.
If this is not our last wave, how should we begin to think about getting to the endemic stage in which we no longer treat this as a perpetual crisis?
Well, I think that goes back to preparation. I mean, I think one of the things you talked about was the availability of vaccines, the availability of testing and treatments if people are positive, to make sure that they are, able to get those resources. When it is not disruptive to our economy, to our community, to our citizens' lives, then that's when we'll be in that position.
We're going to get there.
We're going to get there.
New York City is going to get there.
Yes.
The United States is going to get there. I hope the world is going to get there. And I hope that what folks have heard throughout this discussion was not cause for panic. Because I don't think you're panicked. I'm not panicked. What we want now is for people just to continue to take this seriously, to take simple steps to keep themselves and their families safe. That we released our plan that we called the Stay Healthy to Stay Open plan, which is focused on getting people boosters, focused on getting people resources like these COVID safety bags that we're passing out that have tests and thermometers and more, ensuring that people continue to get tested regularly. We can do those simple things. They're not draconian. They won't disrupt our lives, and it will keep us safer. Knowledge remains one of our best weapons. You have given us an enormous amount of knowledge this hour, Dr. Kass. I am grateful to you and to all of you who have joined us and for your amazing questions. We got to many of them, but there's so many coming in that we unfortunately are going to have to do another session to continue this conversation. So I'll give it to you for closing words, and then I'll close this out.
I would just say that we are not in the same moment now that we were 2 years ago, and that we are prepared as a city to address this pandemic with knowledge and with the confidence that we are going to take care of each other. And we're going to continue to do what we've done in the past, and we're going to stick together. And I think we're going to be okay. I really do.
Amen. An inspiring note to end on. Thank you for all of you who have joined us for this live Q&A. We'll be posting the video so you can review it or share it with your friends. And I promise, if you all ask us, we'll be back to do more of these in the future. Thanks again, everybody. Be safe and have a great night. Bye-bye.